Gestational diabetes. What is it? Gestational diabetes, GRAND, is a temporary condition characterized by elevated blood sugar levels in pregnant women, typically developing in the second half of pregnancy and disappearing after childbirth. This condition is the most common complication of pregnancy, affecting about 7% of all pregnant women. GRAND occurs because pregnancy causes changes in a woman's hormonal balance, which can lead to decreased insulin sensitivity, the hormone that regulates blood sugar levels. As a result, the pancreas may not produce enough insulin to manage the increased blood sugar levels. Risk factors for developing GRAND include being over 25 years old, having excess weight or obesity, a family history of diabetes, having GRAND in previous pregnancies, hormonal balance issues, and other conditions such as polycystic ovary syndrome. Symptoms of GRAND can be subtle or nonspecific, making diagnosis difficult. However, some women may experience frequent urination, excessive thirst, fatigue, weakness, and increased appetite. GRAND can pose risks to both the mother and the fetus. Pregnant women with GRAND have an increased risk of developing preeclampsia, a pregnancy complication characterized by high blood pressure and protein in the urine. There is also a risk of developing diabetic ketoacidosis, a serious complication that can lead to coma and even death. For the fetus, there is a risk of macrosomia, excessive birth weight, which can lead to complications during delivery and an increased risk of obesity and diabetes later in life. However, with proper treatment and blood sugar monitoring, most women with GRAND have a favorable prognosis. Typically, blood sugar levels normalize after childbirth. However, women who had GRAND are at an increased risk of developing type 2 diabetes in the future. Treatment for GRAND includes a low-carbohydrate diet, physical exercise, and insulin therapy if necessary. It is also important to regularly check blood sugar levels and visit a doctor for ongoing management. In conclusion, it is important to emphasize that GRAND is a temporary condition of elevated blood sugar levels in pregnant women that can be dangerous for both mother and fetus. However, with proper treatment and monitoring, most women have a favorable prognosis. It is essential to consult a doctor if any unusual symptoms arise to start treatment promptly and prevent complications.